Hello, everyone. The pod is back. It's been a minute, just been crazy busy. And every time I think about recording an episode about something, there's just lots of news going on. I know you know, but trying to get back in the swing of things. So, wanted to do a bit of an intro on today's episode. If you have been following along on social media or even reading the newsletters, I'm sure you're aware that I've been pushing pretty hard for postpartum Medicaid extension here in Wisconsin. We are one of only 2 states that does not offer Medicaid coverage for postpartum women up to 12 months. We are only at 60 days, which is not cutting it, and women are dying because of it. We recorded this last week before the House at the federal level voted in favor of their budget resolution bill that passed, which will almost certainly result in significant cuts to Medicaid. Now, we don't know what's going to happen with that yet. It still needs to go through negotiations. It needs to go through the Senate, and they have kind of their own version of the bill. We'll have to see what happens with that, and we certainly don't know where the cuts are going to be. So in the meantime, we are just going to keep doing what we do. We're going to keep showing up. We're going to keep fighting for these women who deserve better, and we're going to keep holding the leaders who don't feel like doing anything with this accountable. Today on the podcast, I'm really excited for you guys to listen to this conversation. They are from an organization called Mom's Mental Health Initiative, who just does amazing work. You'll hear from Sarah Ornst Bloomquist, who's the co-founder and executive director, and Casey White, who's the marketing and communications manager. They'll talk a little bit about their stories, too, of how they got into this and why it matters so much. They are just champions for moms. They specialize in solutions that provide support for mood disorders during the pregnancy and postpartum period. And what's really cool about this organization is they act as a bridge between the community and traditional healthcare setting. And I never really do trigger warnings at all because a lot of the stuff we talk about here at Motherhood for Good has a lot of hard truths to it. I would have to put a trigger warning on everything, but I do want to make a note that this is a difficult conversation. We talk a lot about maternal mortality and morbidity. We talk about postpartum depression and anxiety and panic attacks. So if you are in this vulnerable period and already struggling, just take care of yourself. This may not be the episode for you right now, but if you do need help, please reach out to Mom's Mental Health Initiative. I'm also going to put some notes in the show notes for a couple other organizations if you are struggling. That would be great to reach out to because you are not alone. It is not your fault. You are a great mom and or human being. So here you go. Thanks for listening. Thanks for caring. Thanks for making all these calls. We are going to get this done, and we're not going to leave any moms behind. Thank you for joining us. There's been a lot of conversations in our community recently about mental health, especially in the perinatal postpartum period, and you guys are doing incredible work here in the Milwaukee area on that. Sarah, I know I first met you a year or two ago at a roundtable event we had at the Little Village where we were talking to people about this, and it was so amazing to hear from everybody, but also to hear your expertise on this. So I'm so excited you guys are joining us today to talk a little bit more about it. Welcome. Hi, how are you?
Well, thanks for having us. Doing all right.
For folks who aren't aware of your organization, tell us a little bit about it and what your mission is.
Our organization is a grassroots nonprofit that we launched in March of 2016. And really our mission is to help moms and birthing people, perinatal people, which is pregnancy up to roughly a year postpartum, navigate what we call perinatal mental health disorders. That includes postpartum depression, postpartum anxiety, pregnancy anxiety. We also include OCD, panic disorder, bipolar disorder, all in that perinatal period. And we do that by connecting people to resources, to options for healing and recovery. We are a bridge. And so we want to bridge them to those options and those opportunities to get better. We also provide peer support in that process. We firmly believe that peer support is another form of treatment and support. And with connecting with someone who has experienced it, understands what you're going through, that's very powerful in your process and in your recovery. Just knowing you're not alone, seeing somebody else go through the process just validates what you're experiencing. We also provide a lot of education and training around the patient perspective within the community to the healthcare communities. What is someone experiencing? How does it present? What do they need to get better? And then we also provide group peer support.
In the healthcare industry, especially as it relates to mental health and women's health, especially, pregnancy and postpartum, there, I think, tend to be some gaps. And I think, by you explaining, we're a bridge, that's really helpful to have when it's really difficult to navigate just our healthcare industry in general, let alone those times when you are pregnant or postpartum and there's so much going on and you're so overwhelmed and feel like you're the only one in the world who is like that. And it's so amazing to have an organization like yours to reach out to and help guide people on that journey. Casey, how did you get involved and why did you get involved? Why is this important to you? I'm assuming maybe you both have stories of what led you to this work.
Yeah, so I was a mom that we helped. So I knew about Mom's Mental Health Initiative. I had done a story about them as a news reporter years before. And then when I had my first child, I was struggling. And someone close to me told me, well, I think you need a therapist. And I remember thinking, how do I get one of those? I was past 6 weeks postpartum. I wasn't going to have another doctor's visit. I hadn't had a therapist who understood what I was going through. I was having postpartum anxiety. I was having panic attacks. I was like, why did I become a parent, even though it was everything I had ever wanted? And I was like, wait a second, there's this organization out there. So I went to the website. I found my therapist, who is still my therapist today, and has truly made me a better parent for seeking out that help. And then a job opening came up, and it's been the most fulfilling career opportunity of my life to be able to support other people who have gone through something that has truly changed the trajectory of my life.
Yeah, I mean, the more you are just engaging in your purpose in life, I think it was I think Glennon Doyle said this, but she may have gotten it from somewhere else, but it's find out what breaks your heart and do that. And I think, to an extent, it's the things that really impact you that you can have the biggest impact on in your life's work. Sarah, did you, I think I've heard you talk about it. You struggled with one of your kids also, right?
Both children. So I had postpartum depression and anxiety with both children. My first child, it was an acute onset. So really started feeling the symptoms as soon as he came out. I was having some of those intrusive thoughts. Definitely panic attacks. And I had to work really hard to get my medical community and my medical team to hear me and listen to me, on top of dealing with, again, it was February in another state, and we were dealing, my OB had the influenza and the therapist had pneumonia that they connected me to. And, so-and-so wouldn't prescribe this. And so-and-so, it was really a mess. That propelled my illness even further. If I had been attended to when I started speaking up about it, which was pretty much within the first week of having my baby, I probably wouldn't have suffered as long as I did, or as badly as I did. I even had to go to the crisis center at the hospital, and it just was a really agonizing and painful time and very traumatic. And with my second baby, I was very well prepared. I had a strong team of healthcare providers and mental health therapists. I was taking medication, and I had to add another medication when she was born, because it was like PTSD, my body just responded, those hormones. drop as soon as that baby comes out, and that affects your brain chemistry all over. And so I was doing better, and then there was some sort of maybe my meds just didn't mix very well, so I went off one, and then within about 3 months postpartum, I had slipped back right into depression and anxiety. And thank goodness for my parents who kept the baby. I stayed with my sister because I couldn't care for the baby. My husband took care of our son. Like, it was just, and once I got the right medication, of course, working with my therapist at the same time, it was a quick turnaround. But, it was like I went from feeling like fully bonded with my baby to just not being able to handle hearing her cry or pick her up, and set me in a full-blown panic. So, yeah, so I went through it 2 times.
Yeah, and it's, I've talked to so many friends about this and so many people within our community. It's something that's so clear to me is how every person's situation is so unique, and even every person's pregnancy can be really unique too. Yet I've heard from people who had very terrible postpartum depression, and then they were very concerned about the next one and just had a totally different experience. With my 2, I never got diagnosed with anything during my first, but I wasn't seeing a therapist or anything like that, and I wasn't on any meds. And then with my second, and I have like a 4-year gap, I had been seeing a therapist for a while, and I actually had been on meds, and I worked with my care team to like see if I could stay on them, and I was nervous about it, and they were all like, yeah, of course. And that was even shocking to me. I was like almost anticipating pushback there. But it was such a different experience with my daughter. I think just because it just can be a different experience with different births, but also seeing my mental health practitioner regularly, having an OB that listened to me, being on the right meds, it was amazing. And then looking back on my first one, I was like, oh, okay, that probably wasn't normal. Yep. I didn't need to sit in the bathroom and like make sure my husband was bathing the baby the right way every time. That probably was not normal.
A little obsessive.
Yeah.
Yeah, it's funny how you don't realize some of the pain that you're in until you experience something without that pain. And you're like, oh my gosh, maybe I had postpartum depression or anxiety. And sounds like you had an excellent care team, one who's updated and on the current medication information. We always look at risk. Mm-hmm. Is there a risk of not taking it that's greater than the risk of taking the medication? And that powerful tool of listening and feeling heard and having a voice in your whole birthing journey is crucial to your mental health.
And luckily, I mean, I was at like Fredert in the medical college, and they also, I think, work directly with like a perinatal psychiatrist, I think, I didn't need to see, but they're like, if you want to speak to them, you can do that, which I think is amazing. And I guess my next question is, since you founded this in 2016, I mean, it's been a minute now. Do you see, even though things are still infuriating with the amount of support and kind of how slow women are supported in this, are you also seeing good strides?
Yeah, I would say so. I think the landscape has changed a lot since we started Mom's Mental Health Initiative. I like to think that we played a role in that as well. We are seeing many more services being offered, much more attention being put on it. We have a maternal mortality review team who is looking at pregnancy-related deaths, also seeing the role that mental health is playing in those deaths. We have the Periscope Project out of the Medical College of Wisconsin and Fredert, like you talked about, run by Dr. Christina Wickman, who's a perinatal psychiatrist. It's a psychiatric access program for providers. I think there's been a lot of change. We've had more attention and more support from the state regarding funding that's being put towards community organizations who are supporting pregnant and postpartum people. So definitely improvements. There is a long ways to go, but it's definitely different than it was in 2016.
Right. Yeah, that's a net positive overall. But so what are like for people maybe who are listening who haven't gone through this or given birth, like what are some of the biggest gaps?
I think one of the biggest gaps is just that medical providers are not taught about perinatal mental health. In a lot of our conversations that we've had, they may have one page of one book at some point in the psych rotation where they learn about perinatal mental health conditions. Like many areas of women's health, it's not something that's studied or talked about enough, and you really have to seek out the training. So I think just from the jump, the second you go into the medical system to get care for a pregnancy or have a baby, there's not enough information or understanding. And then there's a lot of misinformation and misunderstandings that are perpetuated throughout systems. So that's just like an initial gap in the umbrella of women's health. And then we weren't meant to parent in silos. And our society is so much more isolated, especially we look at a post-COVID world where people got so used to being in their space because it was a safety thing. As we've come out of that in the last couple of years, there's a lot of social support that's lacking. People are farther away from their families just in the way our world is. And it's harder to ask for help. Childcare is harder to access. Parental leave is not as available. And all of these things impact your mental health as someone who is like pregnant, postpartum, trying to navigate this world. And then like Sarah talked about, the hormones drop. And so there are all these gaps in our systems. And then there are gaps in care. There are 6-month wait lists right now for behavioral health. So when you talk about going from having a newborn to a 6-month-old and you're struggling with your mental health during that entire window of time, you're missing it all while you're suffering. That's an enormous gap.
I remember with both of my kids, you fill out basically the only time they check in on you and your health is like when you're at the pediatrician appointments. They give you like a little slip that says like, how are you feeling about, are you crying all the time? Are you feeling about, like, it's like, yes, I cry as much as the baby does. And it's hard to figure out if it's like normal stuff or something more. And I feel like I filled those out pretty truthfully, and it was never met with really anything. And luckily I had care in place that second time. But like, what happens? Do the pediatricians have the proper training to know when you fill those out what to do? And then can you even get care if they know where to send you?
Right. And this is a major problem within the health system is there's huge gaps in time. So you have your baby and they say, we'll see you in 6 weeks. Well, a lot can happen in those 6 weeks and a lot can happen after those 6 weeks. And you might get screened by your OB. You should be getting screened at least once in every trimester. And then when you go to your well child visits and you get screened, I think it's wonderful that pediatricians are screening. They're the ones that see the mom. They see how mom is interacting with the baby. But they're not the mom's doctor. Mm-hmm. So they might get a screening. And when you screen someone, you should always go through the results with them and talk with them about it. And secondly, you have to have a proper referral structure in place, a proper follow-up process. And lots of times it's just, well, you might want to call your doctor and see. And it's like, okay, I call my doctor. What do I say? What do I tell them? How will I get them to listen to me? How do I get past the nurse? What can they do for me? My co-founder's doctor said this is not an obstetrical issue and referred her to a sleep clinic who's full-blown anxiety. So that's a huge problem. And unfortunately, a lot of women are lost. A lot of people get lost and they fall through the cracks. I think what can be really beneficial is when you have a proper referral plan, you have those identified therapists, those identified doctors that you can call and say, I have somebody who needs to be seen. They need to be seen right away. I'm very concerned about this because this is impacting their parenting and their ability to effectively care for themselves or for their child and advocate. Some do that, some don't. And there's just no like consistency of care across the board. It's just like, hopefully you get a great doctor who attends to your whole person. But that doesn't always happen.
Yeah, and I can't, the urgency, like you just mentioned, is so important. I'm thinking back to those days, and even as somebody who, I was lucky not to struggle terribly, but every day feels like
The
a
longest
whole
day of your
nother
life.
feat. Yeah, yeah. And it's like, I can't imagine telling somebody you really need help and then having to wait 6 months to see somebody. It's like, I understand how women do fall through the cracks. So then let's talk a little bit about maternal mortality and our abysmal record there in the United States of America. Can you talk a little bit more about that and how that's studied and what we know and how we stack up in Wisconsin?
Where do we
You
begin?
have plenty to say.
Yeah. A loaded question.
So Wisconsin is among the worst states for maternal mortality. We're lucky that we have a maternal mortality review team, and they look at the records of women who are having babies in our state and analyze mortality and morbidity, which is like injury and death. It's bad. It's not good in Wisconsin, and the rates are worse for women of color. And mental health is the number one complication of childbirth. It is the leading cause of death, pregnancy-related death in Wisconsin. There's an entire report that came out from the maternal mortality review team about isolation and the role that that is playing in maternal deaths in our state. So it's being studied. It's just the gaps are being highlighted and not necessarily filled.
Right. I think it's important to remember that when this maternal mortality review team is reviewing these deaths, they're looking at what's pregnancy associated and what's pregnancy related. So sometimes a death can happen in that perinatal period, but it's not, it doesn't trace back to the issue being they're pregnant or postpartum. Pregnancy related deaths do. And so when we talk about the death rate, we're talking about the pregnancy-related deaths. And what we see is a majority of them, many of them are happening 6 to 9 months postpartum. And in Wisconsin, mental health is the leading cause. It's not that way in every state. Sometimes cardiovascular conditions, heart conditions play that. But in Wisconsin, we're looking at suicide and overdose. And overdosing is very high. And then that also has to do with how are we treating substance use disorders and how are we criminalizing people who are struggling instead of engaging in harm reduction practices. Are we just calling CPS like the minute there's a positive drug screen instead of like getting somebody actual help? So we're looking at pregnancy-related deaths, and the maternal mortality review team makes recommendations, like Casey was saying, how do we address these and fill these gaps? And they've made, recommendations that have to do with more community building and community services and peer support, really emphasizing the importance of peer support. And they also recommend that we extend postpartum Medicaid benefits past 2 months to be about to go about 12 months postpartum. And that is across the board. The review team makes that recommendation. I could say many other professionals that work in maternal health make that recommendation. Again, these deaths are happening past the 2 month mark, and people aren't getting that access to care. They're having to re-enroll, and they're lost. And the system fails them.
Lost and left behind.
Right.
And I was talking to Dr. Lyerly recently, and I think she mentioned that like 80% of these deaths are preventable. Right. And just to be clear, this review board you're talking about has, there's physicians on it, right? It's not just like
we've got
bureaucratic.
You have to
These
apply.
are the experts, and they even try to get people with lived experience who either lost somebody or came close to losing their life. I mean, this is a well-qualified board, and they are looking into every single death. I mean, they spend a good chunk of their year looking into these deaths. And so this isn't just some willy-nilly, oh, we're going to make this up to blow up numbers. No, I mean, there's no point in lying about it. It's what is, and we're failing people because there's no reason you should die from a mental health disorder, which is highly treatable, as well as substance use disorders, treatable.
Yep. Yeah, I can say that. I'm coming up on 8 years sober, and I do not believe that addiction is a moral failing. And I feel there's so much hope out there for anybody who's struggling with it. And I only started to get better once I was met with compassion and somebody telling me, like, yeah, maybe you didn't make some great choices, but also, like, this isn't all your fault. The system is, like, working against you. And there's so much marketing to women. There's so many issues with women in addiction, especially with alcohol. I mean, there's so many other issues as well, but it's, like this pink whatever. And then don't even get me started on the mommy juice and all of that. And I imagine, in the postpartum period too, when you're struggling, people turn to things they've done before that have made them feel better. And when you're that sleep deprived and all the hormone shifts are going on, I can imagine how it could get really bad really fast. And that's one of the things I do know for sure about substance use disorder. It's like it's little by little and then all at once sometimes. And I think doesn't discriminate.
Right. And pregnancy can be a great deterrent, when you're pregnant and you're like, oh, I'm not going to drink, I'm not going to do this. But then you have that baby and you don't really have that deterrent of being pregnant anymore. Mm-hmm. And then the sleeplessness and the lack of support and, colicky baby and incessant crying and who knows what else. You need to cope. And if we have a behavioral health system that can't get you in for 6 months, you're going to turn to other things to cope. I always say to people, in 6 months, they might not even be alive. So we need to do better.
We're the one of the worst for maternal mortalities in the country, but also we are one of only 2 that has not extended postpartum Medicaid to 12 months. And with everything we've just talked about, 6 weeks 8 weeks, which is our current 60 days, is nothing. It's nothing. So many of the deaths happen after that period. A lot of people don't even start feeling at risk until after that, let alone talk to somebody about it. Do you have any thoughts on what is holding us back in being able to do this one simple thing that, by the way, is like incredibly bipartisan, almost weirdly so in this day and age? It was like the bill was reintroduced by Republicans in both chambers this session.
It's astonishing when you look at the lawmakers that support this, how many names are under the postpartum Medicaid expansion bill. And I mean, the other state that hasn't done it has taken more steps than we have toward it. So we stand alone as not taking action.
I think this idea that you have to pull yourself up by your bootstraps. No one chose to have this baby. You chose to have the baby. You got to deal with it. Our moms dealt with it. All these people in the past. And that's really an unhealthy attitude to have, because what we do know is that 1 in 5 women will experience a perinatal mood or anxiety disorder or substance use disorder. We know that 75% of those that screen at risk never receive treatment. So if we look at that and we realize that costs about $32,000 per mother-child dyad to go untreated. So it's that cost to society, loss in workforce.
Not acting is a cost to society.
Yes, not acting is a huge cost. So, costs are labor issues. I'm talking about like work life, not having the baby. And then complications that can arise. It can definitely impact development and in your baby, social emotional development. It can also cause preterm labor. It can cause low birth weight. We're seeing so many different results of untreated mental health conditions, that when we look at these statistics I just threw out in the 32,000, and we look at the rate of the birthing rate in Wisconsin, it costs almost $300 million to the state to not be treating these conditions. And so with the whole argument, like, we don't need to give away more free stuff, it's like, well, we kind of are already in a backwards way. Why can't we do more upfront so that we can save down the road? And then we don't have these continual cyclical issues that are running through families regarding mental health because the treatment isn't available, the treatment's not there, the healthcare is not there.
And when we talk about protecting our kids and protecting the future for our kids, the first indicator of a child's health is their mother's health. And so if you have unwell parents, you're going to have unwell children, and those things tax, yes, financially, our systems, our healthcare systems, our school systems, our businesses and our communities, and, people's ability to work and be a productive member of society. And then also think about families growing up potentially without moms, without parents who are able to consistently show up. The costs are both fiscal and social.
Yeah, we're not just talking about a mom dying. We're talking about a kid that's growing up without a parent, and the ramifications that has on them and on our society. It's just, it is mind-blowing to me, because it's like, I don't know how we couldn't get around supporting moms in this very vulnerable period. And we have. When you say we stand alone, we may stand alone in the 50 states, but we all stand together on this. I was at the hearing, at the Senate Health Committee hearing last week, and everybody was in favor of it. Not only all the physicians, but people from the insurance industries. There were pro-life people, a Catholic community, and everybody was in favor of this because it is also pro-life legislation.
I mean, we talk about these deaths, but we don't talk about the near deaths. I mean, we might have people dying, but we also have people who almost die. Mm-hmm. We have people who want to die. And we have people who are screaming for help and aren't getting it. And it's not just because people aren't reaching out. They do reach out. They do say, I need help. And we're not meeting that need in the way that it needs to be met.
What message does this send to the women in the state who are being told, nope, you don't even get a vote, let alone a hearing? That's not important enough to us to even move it through the system when the votes are there. Right. I mean, that's damning.
It's not listening to constituents. And we look at other states and we're starting to see, improvements in their numbers. And this isn't like, oh, we're just throwing money to the wind. I mean, we're actually would be making improvements in maternal care.
It's a no-brainer when you look at something that, because 48 other states have done this, you can see the impact.
I mean, Texas, Mississippi, Florida.
Right.
Florida.
Why not Wisconsin?
Right. Why not Wisconsin? Yeah. And I mean,
and it's really scary because Wisconsin, we have these statistics. Obviously, we know, we've seen the disparities. Women of color are Black women, brown women, Asian women, Indigenous women, Native women. The rates are so much higher for them. And you can't ignore that. Like, it's data, right? And then we look in the more rural areas and we're closing maternity wings. We're closing hospitals. I do a lot of work with local and tribal health departments across the state. And I mean, some of them just we don't have any resources. Like, the nearest doctor is 30 minutes away and we don't have a therapist that we can easily access. And so, I mean, we need to provide healthcare, and we need to make the state an incentive for healthcare providers to want to work here and want to be able to do what they have committed to doing and working in maternal health. And we're just not supporting that.
Having more people who have access to healthcare creates a healthier everyone, workforce, healthier kids, healthier people, like fewer people who later on need to access the healthcare system with more expensive problems. I guess the question that I have too is, if we're not going to do this studied, proven, well-supported thing to help moms be healthier after they have children, are we going to start talking to the healthcare systems, to the insurance companies, to reduce premiums and make it affordable, to lower costs on accessing therapy and things like that? Like, if this is something that we don't want to do, what do we want to do to make healthcare accessible? Because that's really the issue, is that Medicaid benefits are more easily available in pregnancy because it is a vulnerable time period. When that runs out, these people can access fair market health plans. But if you don't make enough money to be able to afford the care through that, you just are left without healthcare. Do you want these parents to choose to get medical help over feeding their children? Is that the choice that you want them to make? Do you want these parents to go into debt to access the healthcare that they need? Should they charge it to a credit card? Because I have a feeling that would get judgment as well. You're telling me that you don't want to put postpartum Medicaid expansion forward for a vote? What do you want to do?
Because doing nothing is not an option. People are dying. Women are dying. We're going to do nothing? When most people have said, yeah, I'm willing to do something. Democrats, Republicans, pro-choice, pro-life, doctors, insurance. We're going to do nothing.
If we don't do anything, we're just causing more harm. And we have the data show that harm is happening. So what are we willing to do to reduce that harm? No man is an island. So, it's a ripple effect. If a mom suffers and isn't getting treatment and they aren't able to build in bond with their baby, and then that baby doesn't get the benefits of bonding, and then, throughout their lifetime, they're dealing with some of the developmental issues because they didn't get proper bonding. And if we're not doing anything, we're still causing harm.
It starts immediately, right? When a child is born. I was talking to Corinne Hendrickson a while ago about funding for childcare, and she was talking about how, like, there's so much that happens in those early years too, that actually there's statistics that ties it to, like, higher prison rates and incarceration if they don't have access to things. And so, yeah, immediately, if a child is born into a situation that is unhealthy and the mom isn't able to get the care that they need, you're so right. It's a domino effect that sets them up for other things that ripple out into society. This is not, like, done in a vacuum.
This is not giving away free things. This is investing in people and investing in your community and investing in your state to make it a stronger, self-reliant state. I do know that a lot of birth workers don't get what they're due. And then that has to go private. And then people can't afford that. They can't afford, maybe their child needs help with their latching, but they can't afford that.
And oh my God, latching, don't even get me started on, like, all the societal pressures of, like, breastfeeding and everything that comes along with being a mom, and nothing is ever good enough. And, you see these perfect moms on social media all the time. I'm happy more people are talking honestly about it these days, at least, because I do think, like, women are talking to each other more, and you do see more stuff on social media of people being real. I actually posted a reel that I, like, almost didn't, where we were trying to take a family picture with, like, a timer, and I just, like, snapped on my son. And it was, like, when my daughter was so really young, and I posted it kind of funny, but in the caption I was talking about, I'm like, this is about when I talked to my therapist that I was a little concerned I might be experiencing some postpartum rage, which is, another thing that isn't really talked about as much. And it just, like, of course, it's like this just quick video of me, like, screaming at my kid. And of course that, like, goes viral. I'm like, oh God. But I think it did because it just, like, resonated with so many people. And there's so many of us who we have a lot to be rageful about, whether it's societal or physiological and all of this stuff that happens. So I'm hoping that we can continue to shed a light on the work that you guys are doing. It's so important, and push our legislators and the people in power in this state who were elected to protect the people of this state to do their job, and at the very least extend postpartum Medicaid to 12 months for new Wisconsin moms.
It's not political, it's human, and it's necessary. 6 to 9 months is the highest risk time period for someone to die by suicide or from an overdose. That's so far beyond where the benefits reach at this point.
Nobody's choosing to have a mental health condition. Like, they're not choosing to have postpartum depression. This isn't a choice, and they just are milking it and want attention. I had one therapist say, I love working with, perinatal clients because they want to get better. People want to be well. They want to get better. And this is not a character flaw. This is a disease. And we need to treat it as a disease. And it's not a disease that someone can cause. It's full of shame and it's full of lies. And you're trying to combat that on top of being deprived of sleep, taking care of an infant, taking care of other children. This isn't people making bad choices. This is about people being ill and not getting the care they need and deserve.
Yeah, I think for anybody who's really struggled to claw their way out of the hell that is a truly dark place of mental health crisis, they wouldn't wish it on their worst enemy, not even Robin Vos.
No, I mean, it's an awful, awful journey. Don't wish it on anybody. You might recover, but the sting is still there. And I think that's why so many people want to be involved and want to support others, because they know the hell they went through and they don't want others to go through that.
We've got a lot of people in this fight and we're making noise on it, and talking to people from all corners of the state. So hopefully we can make this happen. And thank you so much for joining us today and for all the work that you're doing. It's so important that we support moms.
It's time.
It's time. It's been time.